Hi everybody, welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to fix low back pain. But first, please subscribe, like, and share your best tips that you have found to be super helpful for relieving back pain in the comments section below. If you have someone in your life who you want to support, please share this video with them too. Also, this video is purely for informational purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. Did you know that 80% of the population will get back pain at one point in their lives? That's a huge percentage. What's worse is that after a serious episode of back pain, you can have a 23 to 80% chance of getting another episode within 1 year. Now, most of the time, back pain will clear up within a few days to 6 weeks. Obviously, more serious or repetitive injuries can take much longer than that. But even just a few days of having back pain can feel excruciating. It can completely disrupt our normal lives, jobs, school, chores, and caretaking duties. Sometimes back pain can be so bad that we can't roll over in bed, never mind get out of bed without help or even put our pants on by ourselves. Why do we get back pain? In general, the four most common structures that cause low back pain are the muscles around the spine, the discs between the bones of the spine itself, or the nerves coming out from the spinal cord. Of course, there are other diseases such as cancer and infection that can lead to low back pain, but this video will specifically cover what is referred to as mechanical low back pain. How can we tell where the pain is coming from? In general, the type of pain you feel can really tell us a lot about what structures are affected. If your back feels tight, likely it's a muscle strain that's causing back pain. If your back feels stiff and locked up, likely the joints and discs in the spine are affected and causing your back pain. If you feel pins and needles, numbness in the legs, a tight elastic feeling in the legs, or a weak or wooden leg, likely it's the nerve being pinched and causing problems further down the leg. Keep in mind that it can be a combo of muscle, joint, and nerve irritation as well. Of course, nothing is ever that simple. Other factors that can cause back pain include flat arches or high arches in your feet, weak buttocks muscles, also known as your gluteal muscles, weak back muscles that get tired easily when sitting or standing, tight hip flexors from sitting all day that cause the pelvis to be pulled forward, weak core muscles mostly from sitting or poor posture. So here are 30 tips to help with getting rid of low back pain. Number 1, if you have pain for more than 2 weeks, seek some professional guidance like a physiotherapist who can evaluate your unique situation and make sure you are doing the right things. Often more serious back pain can take 6 to 8 weeks to resolve, but obviously the faster you can get rid of the pain, the better. If you are limping or twisting your body to avoid painful positions, other painful injuries can come from the compensation. Number 2, don't stay in bed. Try to move around. Walk a little, then rest, and then get up and walk a little bit more. Although it hurts initially, it can lead to a faster recovery by improving your circulation and stop your muscles from getting short and stiff. Number 3, use a microwavable heating pad for 20 minutes to help with stiff or tight muscles, or an ice pack for 20 minutes to relieve swollen muscles, muscle spasms, help control initial inflammation, or if you are in severe pain. Number 4, try medicated patches or medicated ointments. Ask the pharmacist for some guidance if you're not sure. Number 5, don't sit too long. Aim for no more than 20 minutes of sitting at a time because it can put a lot of pressure on the discs between your spine. Number 6, don't slouch. Sit with good posture. Check out the video in the link for extra posture tips to help get rid of neck and back pain. Number 7, drive with good posture. Put the seat up and get a little closer. Use your cruise control for long drives. Number 8, get your desk set up properly. Have a good adjustable chair, dedicated monitor at eye level, and consider a sit-to-stand desk if possible. Number 9, if you bend or sit for the majority of the day, include exercises where you do the opposite movement. For example, backward bends like the cobra position. Number 10, make sure you prioritize sleep because that's when your body heals. Number 11, try to stay calm and put a stop to any spiraling anxious thoughts. Number 12, consult your pharmacist about any over-the-counter medications like Advil, Tylenol, or Aleve. Try to avoid opioids because they are highly addictive. Number 13, pace your normal activities. For example, instead of doing all the chores and errands, do one task a day and stop when your back starts to hurt too much. Now is also not the time to expect perfection. As long as your tasks are mostly done, so be it. It's okay if things don't get cleaned on schedule, the grass doesn't get mowed, or you need to order takeout instead of making dinner. Number 14, keep your hips flexible. Try the figure 4, spinal twist, bike, or elliptical machine. Number 15, keep your mid-back flexible. Try the cat-cow exercise. Number 16, strengthen your glutes. They are the largest muscle in the body, and they're supposed to be the strongest muscle. One of their main functions is to hold your back straight. That means that if you have weak glutes or a flat butt, your back muscles may be working overtime and easily strained and injured as a result. Try bridging exercises to start strengthening your glutes and work up to squats and step-up exercises. Number 17, put a pillow behind your low back when sitting or driving to help provide some arch support. Number 18, flat feet or high arches can also put more pressure on your low back. Wear good, comfortable shoes that support your arches. Number 19, put an anti-fatigue mat in front of the kitchen sink and bathroom sink to relieve back pain. Number 20, remember to lift by bending at the hips, like a squat, rather than bending at the waist. Try to squat when you're picking something off the floor. Number 21, push rather than pull. When you need to move something or someone, try to tighten your abdominal muscles and push. This puts less strain through your back muscles. Number 22, bend your knees a little when standing in front of a sink like brushing your teeth and washing the dishes. Number 23, one of the actions that tends to tweak your disc the most is a bend and twist at the waist. For example, vacuuming, shoveling, raking, changing your tires, lifting up your backpack, and swinging it over your shoulder. Try to keep the hips flexible so that they can rotate and bend rather than putting that strain through the back, and be mindful of your back when doing that movement. Number 24, get into the unloaded disc position. Lie on the floor with your feet up on the couch for 20 minutes. This position puts the least amount of pressure on the discs in your spine. Number 25, walk outside if possible at a comfortable pace for 10 minutes to get some beneficial pain relieving effects from sunlight and vitamin D. Number 26, rethink your sleeping position. The way you sleep may be impacting your spinal alignment and giving you back pain and stiffness when you wake up. You can experiment with putting a pillow between the knees if you're a side sleeper, or putting it under the knees if you're a back sleeper. Check out our other videos for more sleeping position tips. Number 27, evaluate your mattress. Is your mattress more than 10 years old, or do parts of your mattress sag? Perhaps the memory foam doesn't spring back like it used to. Considering the fact that we spend or should spend about 8 hours a night sleeping, it's a pretty good investment for your health. How much do we spend on clothes that we never wear? We don't even use our cars as much as the time spent on the bed. Mattresses have changed a lot in the past 20 years. They used to be thin and lumpy, needing to be flipped every few months, made with hard coils, always needing a box spring, and the most popular size was a queen. Now mattresses tend to be taller, padded with memory foam, with cooling technology, doesn't need to be flipped, and often doesn't need a box spring. Also, here's another important tip. Buy the largest mattress that you can afford and fit it into your bedroom. That way you have a lot more space to flip onto either side and spread out comfortably. Like pillows, there is not one mattress that will suit every body type and specific health condition. Go into the store and spend some time lying on the latest mattresses in your usual sleeping position to really get a sense of how your back will respond. Number 28, wear a back brace for more physically demanding activities like lifting, gardening, home renovation, and some harder occupational tasks. Number 29, have a coach review your technique when you play sports. Do you over-rotate during golf? Are you using poor form when you squat? Are you running with poor body mechanics? Number 30, ask if you need to adjust your equipment to suit your body frame better. Is your golf club too short? Is your tennis racket too heavy? Is your bicycle seat too low? If you have some great health tips that help you with getting rid of low back pain, I'd really appreciate it if you could share them down below in the comment section so that we can all benefit in our personal journey to better health. Please subscribe, like, and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.